Across Europe, about 7 to 8% of children have caregiving responsibilities. Our research is intended to highlight the mental health experiences of those children, focusing on the ages of 15 to 17 years old, those critical adolescent years in which young people transition to adulthood. The first phase of our MeWe project work utilized an online survey developed by our team here at the University of Sussex in Brighton, England, in the United Kingdom. The survey featured a variety of assessment tools, namely the MACA and PANOC, which are two instruments designed specifically for use with young carers. We also utilized the instrument called KidScreen 10, which was used to assess general well-being. Our survey also used a series of demographic questions on impacts to employment and education. And then finally, our survey concluded with an open-ended question on a young person's preferences for informal and formal support in connection to their caring role. Analysis of data collected thus far revealed that out of over 9,000 respondents, our survey identified over 1,700 adolescent young carers between the ages of 15 to 17 years old across the 6 nations. A typical profile of an adolescent young carer emerged from our data. A girl providing care for her mother with a physical disability. With that said, there were variances across our 6 nations. For example, in the Italian sample, it was revealed that a high number of young people provided care for grandparents, specifically grandmothers. In the UK and in the Swedish sample, there was a significant number of young people providing care for siblings. Across all of our 6 nations, the survey revealed that young people were engaged in multiple caring roles for both family members and for individuals close to them, such as a close friend or romantic partner. A number of findings warrant special attention, namely the high number of adolescent young carers providing very high amounts of care for their family members and friends with little to no formal support. Also, there were substantial numbers of adolescent young carers reporting self-harming thoughts and thoughts of harm to their care recipients, indicating a very high level of emotional distress in connection to their caring role. Finally, our findings indicate a concern about the lack of formal long-term care services and programs in European countries, and of course, how that might impact upon their mental health and well-being. These findings, well, firstly, will be used to develop our intervention in the MeWe project, but secondly, and more long-term focused, they can be used to inform the creation of supportive programs and policy within country-specific settings and at a wider EU level. Thank you.